Antepartum refers to the period of time before childbirth, specifically during pregnancy but before labor begins. Context. Ante equals before, partum equals birth or delivery. So antepartum means before birth. Common usage: antepartum care, medical care given to a pregnant person before delivery, e.g., checkups, ultrasounds. Antepartum hemorrhage, bleeding that occurs during pregnancy but before the onset of labor, e.g., placenta previa, placental abruption. Opposite term, postpartum, the period after childbirth. Want a quick chart showing antepartum? Intrauterine pregnancy, IUP, refers to a normal pregnancy where the fertilized egg implants and develops inside the uterus. Key points: intra within, uterine equals uterus. So intrauterine pregnancy means a pregnancy within the uterus. Why it's important: confirms that the pregnancy is not ectopic, i.e., outside the uterus, such as in a fallopian tube. It's typically confirmed by ultrasound, especially early in pregnancy. A healthy IUP shows a gestational sac and later a yolk sac, fetal pole, and heartbeat. Opposite: ectopic pregnancy, implantation occurs outside the uterus, which can be life-threatening. Let me know if you want a visual diagram. Multigravida is a medical term used to describe a woman who has been pregnant more than once, regardless of the outcome of the previous pregnancies. Word breakdown: multi equals many, gravida equals pregnancy size. So multigravida means a woman who has had multiple pregnancies. Related terms: primigravida, a woman who is pregnant for the first time; nulligravida, a woman who has never been pregnant; multipara, a woman who has given birth 2 or more times, not just been pregnant. Example: the patient is a multigravida at 28 weeks gestation with 2 previous deliveries. Want a table comparing grand multiparity refers to a woman who has given birth 5 or more times to viable, live, or stillborn infants, typically after 20 weeks of gestation. Word break: grand equals large, greater; multi, many; parity equals the number of times a woman has given birth. Classification of parity. Definition: nullipara, never given birth; primipara, given birth once; given birth 2 to 4 times; grand multipara, given birth 5 or more times; great grand multipara, given birth 7 or more times. Clinical significance: grand multiparas may be at higher risk for uterine atony, leading to postpartum hemorrhage, placenta previa or abruption; labor complications, anemia, and other maternal health issues. Shoulder dystocia is a delivery complication that occurs when the baby's shoulders get stuck behind the mother's pelvic bone after the head has already delivered. Key points: it's an obstetric emergency because it can cause injury to the baby or mother if not managed quickly. The anterior shoulder, the one facing upward, typically gets stuck behind the pubic symphysis. Risk factors: large baby, macrosomia, an episiotomy is a surgical cut made in the perineum, the area between the vagina and the anus, during childbirth to enlarge the vaginal opening and help deliver the baby more easily. Purpose of episiotomy: to prevent severe tearing during delivery, to speed up the birth process if the baby is in distress, to allow use of forceps or vacuum, in some cases to assist with shoulder dystocia. Types of episiotomy. Type, description into the rectum. Midline, straight cut downward toward the anus. Angled cut away from the anus. Midline heals faster but has a higher risk of extending into the rectum. Mediolateral reduces rectal injury risk but may be more painful to heal. Recovery. Sutured after delivery. Iron deficiency during pregnancy is very common and can lead to iron deficiency anemia, which affects both the mother and the developing baby. Why iron is important in pregnancy. Supports increased blood volume, which can rise by 30 to 50%, helps in the formation of red blood cells for mother and baby, supports the baby's growth and brain development, prepares the body for blood loss during delivery. Causes. Increased iron demand during pregnancy, poor dietary intake, closely spaced pregnancies, heavy pre-pregnancy menstrual bleeding, gastrointestinal absorption issues. Symptoms of iron deficiency: fatigue or weakness, shortness of breath, pale skin or lips, dizziness or headache, craving non-food items, pica, like ice or clay. Risks if untreated: premature birth, low birth weight, delayed fetal growth, maternal heart strain, increased risk of postpartum depression. Treatment and prevention: iron-rich foods, red meat, beans, spinach, fortified cereals. Vitamin C helps with iron absorption, e.g. citrus tomatoes. Prenatal vitamins, most contain iron. Iron supplements if levels are low, as prescribed by a doctor. Would you like a sample iron-rich diet plan or a chart showing recommended iron levels by trimester?